Sorry about that. Okay, hello and welcome to the Newcomers Community Forum. This is Friday, March 4th, and we are joined today by Hailey Finn, who is our iSmile coordinator here at the Black Hawk County Health Department. And she's going to be talking to us today about dental health and why it's important to get in to see the dentist and about our iSmile program. Is that about right, Hailey?
That is correct. Yep.
Okay. And you have a presentation you're going to share?
I do. Yes. Let me share my screen. Okay. And then start this. Okay. Can you see it okay, or do I need to swap it again?
Swap it again.
Okay. Good.
Perfect. There you go.
Okay, so yes, my name is Hailey and I am the iSmile coordinator for Black Hawk County Health Department. And today I'm just going to talk about the importance of good oral hygiene, give a little bit of information about our program, the services we provide, how to prevent cavities for all ages, and then some good resources and referrals that I can share with you. So the iSmile program is a statewide program, and we connect children and families with dental, medical, and community resources to ensure a lifetime of health and wellness. We do a lot of different gap filling services. So we provide dental screenings, we apply fluoride for children at WIC clinics, Head Starts, preschools, daycares, and then we can apply dental sealants, which are another preventive measure, and we apply those with our iSmile at School program in the elementary schools. And we help coordinate dental appointments with families, help find payment sources. We can help set up transportation and if interpretation's needed. And then we do a lot of community outreach. We promote the importance of oral health during community events. The first topic we're going to talk about is tooth decay. Unfortunately, we see a lot of tooth decay in the counties that we cover. So I cover Black Hawk, Bremer, Buchanan, and Grundy counties. So tooth decay, there's a lot of different things to look at with that. We have to look at the foods that we're eating and drinking, the bacteria that's being transferred. And then I'll talk a little bit about early childhood caries, and that's what we see a lot of in children under the age of 6. This picture right here actually shows a child who drinks a lot of Mountain Dew. So that is where that decay, those holes in those teeth have come from, is the nutrition or what they're eating or drinking. And then this shows us, whoops, let me go back here. So there's 3 things that must be present for tooth decay to occur. You obviously have to have the tooth, you have to have a carbohydrate or where the sugary, beverages or whatever you're eating and drinking, and then the bacteria, and all that together is what's going to cause the tooth decay. Tooth decay can start as soon as the first tooth erupts in a child's mouth. So that's why it's very important to start, good oral habits when the child is very young. This kind of just gives another picture or graphic that you can kind of see. You have your carbohydrates, and then that, plus the plaque and bacteria that sits in your mouth, plus acid, if you're eating a lot of sugary stuff, drinking sugary beverages. And then once the acid is on the tooth and it's not cleaned off, then that's what's going to cause the tooth decay or the breakdown of that enamel that causes decay. And then talking about form and frequency with what we're eating and drinking. So the form, whatever you're eating that's stickier, like stickier foods, sugary stuff, it remains on the teeth longer. So that's creating that tooth to break down even faster. And then with frequency, when we have acid that remains in the mouth for a minimum of 20 minutes, it remains in the mouth for a minimum of 20 minutes each time carbs are consumed. So we just have to be very aware of what we're putting in our mouth. And this kind of just shows, the difference between, obviously water is the best option, And then it shows 68 grams of sugar in just one soda. Another thing that we need to start limiting and be very cautious with children is we're seeing a high decay rate because of sports drinks like Gatorade, Powerade. They have lots of sugar in them. And so we need to be very cautious with that. And then the same thing with juice. Juice is good, but it also has and contains a lot of sugar. So we need to be very careful. We'll talk about it more with other slides, but that's kind of the one thing that we need to be careful with too, with babies, that we're not putting sugary beverages in their bottles. We always want it to be either milk or water. And you always want to make sure that you're not putting the child to bed with a bottle at night. And we'll discuss that further into the presentation here. This with the transferring of bacteria. So actually, children can get decay or the cavity causing bacteria from their parents, especially from their mother. And this is a lot of times people don't understand this. And I didn't know of this until I was in hygiene school, but parents and caregivers should avoid any kind of saliva sharing activities, such as sharing eating utensils, toothbrush with the child, licking or sucking on child's hands, or pacifier use if they drop the pacifier and the parents put the pacifier in the mouth and then in the baby's mouth, or even the bottle. We just want to be very careful with that. And then early childhood caries, like I said before, this is when cavities begin before the age of 6. And unfortunately in Black Hawk County, we are seeing a lot of this. And so it's caused, I feel like it's caused by nutrition. And so we just really need to be careful with the amount of sugar that we're giving our children, and even as adults as well. And usually with early childhood caries, it's called baby bottle tooth decay. And that's usually where it affects the front teeth. So I can show a picture on this next slide here. And that's kind of what it looks like. It just really breaks down that enamel from the constant contact with the sugary beverage or the bottle with the milk in it that they might be put to bed with, which we should avoid. And then cavities can lead to problems with nutrition and growth. It can cause speaking delays. It can cause, with sleeping and learning, just even behavioral issues. If a child has decay, they're going to be in pain. They're going to be restless at night. And so that's why we really need to find ways that we can prevent decay in children early on. And then, so in the first picture here, this just kind of shows how quickly that decay can progress. So the first picture you can kind of see, and I don't know if you can see my mouse here, my little arrow, but right along the gum line, this is where that plaque likes to sit usually. And plaque is what breaks down the enamel as well. And so right there, you can kind of see there's more of a whitish tint along the gum line. And that's where the enamel has started to break down due to that plaque or whatever foods they're eating and drinking. So then if that's, if they're still not having good nutrition, not having good oral habits at home, then this is where it starts to break down. That enamel on this second picture has broken through all the way. Then if they're not getting treated in the third picture, this can just be, like it says, in a few months time frame, depending on their habits at home, then it can turn into a full-blown issue with all of those front teeth, totally breaking down. So this is definitely what we don't want to see. This picture is obviously a little extensive, but we have seen this. And this child is going to be in pain. They could have possible infection going on. They're not going to be able to eat. They might have trouble speaking. And so this is where in this case, this child would have to be taken to the OR, to the operating room, and they would have to have dental treatment. So this is what we're trying to avoid with what our program offers. We are trying to avoid any decay in the future and the spread of decay. So just wanted to show that. It's always kind of, you never really know what it looks like until you see it. And we've definitely seen some mouths like this in children under the age of 6. And this is, so with those areas of decay, if those go untreated for long periods of time, if that decay starts to get into the pulp of the tooth, which is that nerve of the tooth, it can cause some other issues. That's where that pain usually starts with the kids. And then it can turn into an abscess is what it's called. And these are what these arrows are pointing at, these little bumps. And it's basically just an infection of the tooth. And this is when, if we were to see this in our schools that we serve, these children would be put on an immediate referral because that's a dental infection. It's a chronic infection and we need to get this taken care of. So I just wanted to show that sometimes it doesn't even look like anything. It just kind of looks like a normal little bump in the mouth, or it can look red and inflamed. And sometimes it even has drainage with that as well. So we want to be careful that, you know, if your child has an area of decay, that they see their dentist, get it taken care of right away, so we don't have any further needs that need to be done. So we've talked about decay, and then I wanted to talk about prevention for children and for adults. We'll talk about dental visits, diet and nutrition, oral hygiene, and then fluoride and sealant application. So with dental visits for children, we do recommend first visit by their first birthday. This not only it's less traumatic for the child, it's less costly to prevent disease early on, and it just gets them ready to, you know, what to expect in the years to come and in that regular, you know, time frame, that every 6 months seeing their dentist. So then hopefully they won't be scared in the future. So yes, first visit by first birthday. It's best to wean baby from the bottle by age 1. And if a baby requires the bottle to sleep, use only water. Same thing that we had discussed, even though, you know, you might put your baby to bed with milk, milk still does contain some sugars, whether it's breast milk or formula. And we just don't want that sitting in the child's mouth, especially if teeth have erupted. We just don't want that to sit in their mouth and cause that baby bottle tooth decay. So with an infant, you can actually, if they don't have any teeth yet, you can actually take just a damp washcloth and at least once a day, preferably at bedtime, just kind of wipe that around their gums just to clean out their mouth. And then as soon as their first tooth appears, brush with an infant toothbrush. That baby in the picture here, the bigger picture, that's an infant toothbrush. It has a little brush on the other side of it. And we would recommend doing that at least once a day. And we normally recommend doing that at nighttime as well. That's the most important time. And then with brushing, usually we recommend a child-sized toothbrush, and then we want the child to brush at least twice a day, preferably after breakfast and then before bed. I always tell the kids, you know, even if they're not getting the twice a day and they're getting, you know, right before bedtime, bedtime is the most important time to brush. We want to make sure we're getting all that food and plaque and debris out of there before they go to bed. And then I always recommend having parents still help assist with brushing, and actually parents should be helping with brushing until a child is 7 to 8 years old. Even if it's not brushing their whole mouth, you know, having the child brush his or her teeth first, and then having mom or dad check and make sure that everything's been removed properly from their mouth. And then after that age, children sometimes do need some supervision still, but more so just that checking to make sure there's not a lot of plaque left over. And then with flossing, daily flossing should be done. It is a little bit harder with young kids, but luckily they do have, and I should have put a picture on here, but they have little fun flossers now for children, which makes it a little bit easier for them to hold on to instead of doing the string floss. But they have it has a little handle on it with the floss on the end. And so it makes it a lot easier for them to hold on to and get in between their teeth. And that should be done at least once a day. Usually at bedtime is when I recommend that too. And when they're children, they do have some teeth, especially in the front, that sometimes aren't touching. So those don't necessarily need to be flossed, but the ones in the back that are touching, we want to make sure we keep those good and clean. This is kind of just an idea of how much toothpaste they should be using. So with a child under the age of 3, it should just be a little tiny smear. You don't need very much. You want to make sure there's fluoride in the toothpaste, but yeah, you just want to be very careful that they're not swallowing a lot of that, just because we don't want the fluoride to make them sick. And then children 3 and older, the bottom toothbrush there, you can see to use a pea size, so it can be a little bit more. And then just make sure that they're spitting out the excess after they're brushing. This is just a little information about fluoride varnish. The picture down below, you can kind of see this is what we provide in the schools. So we do our oral screening and then kind of look and see, what's going on in the child's mouth. And then as long as parents have agreed, we apply we call them tooth vitamins, but it's the fluoride varnish, and we just paint that on with a little brush. So it's known to reduce decay rates from 25 to 45%. And then we can actually do 3 to 4 applications a year is recommended to reduce the risk of decay in young children. And it's just really ideal for young children, but for adults too, but a small amount is used when we use this. It sticks to the teeth upon contact with saliva, and no one will ingest a ton of fluoride with this, because it sticks to the tooth right away. So it's very easy to use, very easy to apply. And yeah, we just want to help prevent as much decay as we can with that. And then for adults, it's kind of the same thing as far as preventive. We want you brushing at least twice a day with a soft toothbrush and then a fluoride toothpaste, flossing at least once a day. And they also make floss picks for adults as well. So that makes it easy. They have lots of different things that you can use in between your teeth to clean those areas out. So at least once a day. At nighttime is what I recommend for that as well. And then the use of fluoridated mouth rinse is optional, but if you're going to use that, I would recommend using that at night as well. And then every 6 months is when we recommend professional dental care. And I cannot stress the importance enough about getting to the dentist every 6 months, even if you're not having issues with your mouth. We just want to stay, in a routine, getting the cleaning, the exam by a dentist, having x-rays done, having the fluoride application, and just having that registered dental hygienist or dentist give you the proper education, things that you might need to work on. I cannot stress it enough, just because if we can prevent, we just want to prevent all that we can, so then we don't have a bunch of, the amount of money and for treatment costs and stuff like that. It's just very important to get that. And then with x-rays, sometimes people can be a little iffy with x-rays, but it's very low dose radiation. And that's the only way that a dentist is going to see if there's anything going on, with the roots of your teeth and between your teeth. And then having, regular cleanings with a professional, making sure all that tartar buildup, that hard buildup is out of your mouth, the plaque, making sure all the tissues and the gum health is good. That's very important as well. So we stress the importance of every 6 months for professional dental care. Same with diet and snacking. We just want to make sure we're choosing well-balanced meals. We want to snack on, fruits, veggies, dairy, nuts, popcorn. Chewing sugarless gum helps, especially after you eat. It just kind of helps neutralize the acid in your mouth. And then, like we've talked about before, even with adults, we want to limit the sugary and starchy foods. Or like if you're going to eat sugary, foods or drink sugary beverages, just have them at mealtime. So then we're kind of washing all that down at the same time. And then limit the amount of juice and soda pop consumed each day as well. So then, so with our program, we have the I Smile program, and then we have the I Smile at School program. And so just to give you a brief, information about that and the services we provide. So with this, we still do the oral screening. We look at all the teeth in your child's mouth. We provide fluoride varnish. And then if your child qualifies, we paint on sealants. So they're little protective coatings, and I'll show a picture here in the next slide. And as long as there's no decay present, any signs of cavities or any stain, we're able to apply these sealants in the back teeth. Usually we put them on the permanent molars. They go on that biting surface because those molars have lots of tiny little grooves. And we want to make sure that we can help prevent cavities by filling them with this plastic protective coating. So that's kind of gives you an idea of kind of what they look like. It's more of just like a white, clear color. And so that's what we do at the school when we take all the equipment that we need in. We have a dental chair, we have a portable dental unit that we take. So we have everything we need that we can provide the service in our schools. If your child were to ever bring this form home, this is our I Smile at School consent form, and the I Smile form looks about the same. Sometimes they will be different colors, so you might notice that if your child brings this home. So we always have parents fill this all out, consent, either put yes or no, that you would like our services done, and then at the bottom, making sure that you sign both of those lines so we are able to see your child. And then on the right side, this gives you an idea of what our follow-up letters look like. Our I Smile one looks a little bit different, but it's still telling you what we've done today, if sealants were applied, and if we applied the fluoride varnish on your child. And then just wanted to briefly touch base on the school screening requirement. So this is a form, and I will show this on the next slide, but children entering kindergarten need to have this screening requirement done, and children that are in 9th grade need to have this done as well. And this form, here I'll show you right here. This is the form, and it can be filled out by your medical provider, by your dentist, anyone who has screened your child's mouth and provided the documentation necessary. This needs to be filled out when they're in kindergarten or 9th grade, and then you can just have your child return this to their school nurse. And if you, and all dental offices should have this form at their office that they can fill out. They could also fax it to your school as well if needed. And then here are some resources that I've shared with you all. There's the IDPH website, and then that gives just different oral health tips. And then I Smile website, which gives you more information about our program. And then I put the Blackhawk County Public Health website for oral health services to explain that. And then here is my contact information if you ever need anything. I have my direct office line listed and my email listed if you were to ever need help finding a dentist, if you need help with insurance, anything like that, we are able to assist you. That's all I got. Do you have any questions, anybody?
I don't. Do you want to stop sharing and then we'll be able to see?
Yes, let me stop sharing here.
And I am going to stop recording, pause, stop.